Remember to subscribe to our YouTube channel at NDN Nigeria. Click on the subscribe button and be the first to get notifications. Niger Delta Development Commission, NDDC, making a difference.
After 3 months of going around the 9 states of the oil-rich region, the Niger Delta Development Commission, NDDC, last week rounded up the first phase of its free medical outreach program. The flagship initiative of the Commission, which aims to serve the poor and vulnerable across the hard-to-reach areas of the region, was relaunched in April this year by the Dr. Samuel Ogbuku-led management team after it was suspended in 2019. The team, which was at AKUGHA General Hospital, AKUGHA, in AKUGHA West local government area of Abia State, attended to over 2,000 patients battling different health conditions.
The history of the Niger Delta Development Commission's free healthcare mission dates back to 2004, when the then newly established commission attended to the people of Odi in Kolokuma Opukuma local government area of Bayelsa State. This community was grappling with the aftermath of a military operation that claimed numerous lives and left many suffering from varying degrees of injuries and other health challenges. The commission then mobilized medical professionals and volunteers to the community to address the people's overwhelming needs. Since then, the NDDC has made it an annual program to provide critical health services to the rural and underserved populations in the region. This initiative has proven effective, especially given the health challenges accompanying the exploration of oil and gas across the region, which are often exacerbated by the lack of functional and optimally working health facilities. In addition to providing health facilities across hard-to-reach areas in the region, the NDDC continued with this periodic intervention that has gone on to heal the sick and give hope to the medically underserved. However, in 2019, the Commission, which happened to be going through challenges at the time, had to suspend the crucial initiative. And in April of this year, after about 5 years, smiles returned to the faces of the medically underserved in the region with the reintroduction of the free medical outreach. This time, the Commission revealed that the intervention would be quarterly instead of just once a year. Last week, the team's visit to Abia and Cross River states concluded the first phase of the outreach. In the southern senatorial district of Cross River State, about 3,500 individuals were attended to, while in Abia State, over 2,000 patients were registered, 77 surgeries were conducted, 500 free eyeglasses were issued, and more than 1,000 patients were diagnosed with various ailments.
NDDC gave me these glasses. It will help me. I will see more than I'm seeing before.
This idea has been troubling me for past 2 years. Thank God NDDC has bring out this program to come and settle the people that are having the issue like this.
I've been suffering for this fibroid close to 2 years now, and I'm happy, and I want to tell NDDC thank you. Continue your good work that you're doing, touching life.
Dr. Wogu Dennis, the Chief Medical Director of AKUGHA General Hospital, AKUGHA, in AKUGHA West local government area, who represented the Abia State Commissioner for Health, thanked the NDDC for coming to AKUGHA General Hospital for the outreach.
The state is very, very happy with what they have done, because I know that several years back we couldn't access work here, but the rest is history, and then I know more good things are coming.
The Chief Consultant of Durham Global Services, Dr. Francis Onojeta, partners of the Commission on the Medical Outreach in Abia State, appreciated the NDDC for reviving the medical mission across the region. In his remarks, the Managing Director and CEO of the Interventionist Agency, Dr. Samuel Ogbuku, while speaking through Dr. Dimba Eruba, the Abia State representative on the board of the NDDC, outlined the significance of the free health mission.
The NDDC, as an interventionist agency, has championed good health, has been integral to the successful realization of her mandate in facilitating the sustainable development of the Niger Delta region.
The commission also issued mosquito nets to patients during a malaria health talk to commemorate World Malaria Day 2024.
Niger Delta Development Commission, NDDC, making a difference.
Inside the Niger Delta,